breaking the wall of solid tumour shields. Elena Barba Sarasua, Falling Walls Lab, Spain.
The clock is ticking and cancer is winning. Every year, 20 million people are diagnosed with cancer, which is almost 1/4 of the population of Germany. And every year, 9.7 million people die of cancer, which is almost 3 times the population of Berlin. But why is this happening? Because conventional treatments like chemotherapy and radiotherapy are not working. Almost 40% of the patients relapse within the first 2 years of treatment. So we turn to immunotherapies, where we have bispecific T-cell engagers that form a bridge between the T-cells and the tumor cells, enabling these T-cells to kill the tumor cells. And then we also have the very well-known CAR T-cell therapy, which are engineered T-cells that can recognize and kill the tumor cells. These immunotherapies have shown impressive results in some blood cancers, like leukemia or lymphoma. But in the case of solid tumors, they fail in 80% of the cases. So it is urgent to find an alternative for these patients. And that's what we come in. We're engineering T-cells to stab cancer. Stab T-cells act as living drug factories, as they are continuously secreting bispecific T-cell engagers. So they act as effectors, but they also recruit bystander T-cells, thus massively amplifying the immune response in the tumor site. Take multiple myeloma. Today, the standard immunotherapy treatment is CAR T-cell therapy. And yet in mice, they seem to control disease in the beginning, but in the long term, they end up relapsing. Now, can you imagine what happened when we treated these mice with a stab T-cell therapy? They are 100% cancer-free. We published this work in Science Translational Medicine, and we worked really hard to patent this strategy. And do you know the best out of it? That we're treating our first 15 patients in the upcoming months. So this is getting real, and now we're scaling it to solid tumors with a multi-target strategy. For that, we're engineering stab T-cells against surface antigens, but also against intracellular antigens that are expressed on the surface. And on top of this, we're engineering these stab T-cells to secrete NK cell engagers. So just by modifying a few number of T-cells, we're boosting a local immune cascade that stabs and destroys the tumor. And while the clock is still ticking, we are all in a mission to go from this to this, stabbing cancer. Thank you.